Okay, so what I have here is a beautiful sheep heart that I have taken the liberty of removing some of the fat from these nice big blood vessels at the superior surface of the heart. I recommend doing that so you can see them a little bit more clearly. The first thing that we're going to do is position the heart in the anatomical position as if the sheep is laying supine on the dissection tray. Supine meaning belly button side up, facing toward us. So the reason that we know the heart is positioned like this is, first of all, the superior surface, of course, has all of the blood vessels, all of the big blood vessels, and then the inferior surface has the apex of the heart, or the point down here specifically at the left ventricle. The more tricky part is knowing the anterior versus posterior side of the heart, but this isn't too tricky after we learn that the interventricular sulcus runs diagonally on the anterior surface. So the name interventricular tells you exactly what it is. If we break it down into two parts, inter and ventricular, inter meaning between, and ventricular meaning the ventricles. So this sulcus or groove is running between the right and left ventricles. Right being the patient's right, or the sheep's right, not our right. So we have to reverse our right and left so that we're doing it correctly. So this would be the right ventricle and the left ventricle. Notice that the ventricles are making up the bulk of the mass of the heart, whereas the atria are comparatively much smaller. So the interventricular sulcus is covered with fat, but of course we have some important blood vessels underneath all of that fat. On the posterior surface of the heart, the interventricular sulcus is much more vertical between these ventricles. So that's the biggest clue. On the anterior surface, it runs diagonally, especially look at the apex to help you know that it's diagonal there. Okay, the last thing about the anatomical position here is that the apex of the heart would be positioned slightly toward the organism's left lung. So it doesn't sit with the apex directly facing downward. And you'll notice that the left ventricle is quite a bit larger than the right ventricle. We know why this is, but we'll talk more about it when we actually cut into the heart with our frontal coronal cut. So we found the ventricles. The next thing to find are the atria. So if this was the left ventricle, this would be our left atria. The auricle is this ear-shaped extension of the atria. It essentially is the atria. You can think of the auricle like the rim of the atria. So the atria is very, very small. This is the collecting chamber. It doesn't pump blood. Notice it doesn't have this thick cardiac muscle. It's just receiving blood. And then the volume of the blood itself is letting the valve open so that blood can fall into a pumping ventricle. So this was our left atria, auricle. And this is our right atria, or right auricle. Notice it's covered with quite a bit more fat here, but we can still see it pretty clearly. I also went ahead and took my scalpel and I cut the smallest little sliver on the posterior surface of the heart. And I just want to show the visceral pericardium. Think of it like a saran wrap, like real thin layer of connective tissue that surrounds the heart. You can see the myocardium underneath. So the myocardium is that nice cardiac muscle itself. Okay.